Welcome to your stay in hospital. We've put together some information that will help you to have a safe recovery during your stay. So let's get started. Did you know that 1 in 4 people fall over while in a hospital ward like yours? 1 in 3 falls lead to an injury like a bruise, a cut, or even a broken bone. So here are 3 simple steps to help you stop falls. Step 1. Know if you need help to get up and walk around. Being unwell or having had surgery means you are not likely to be as good at getting up and getting around as normal. Even people who think they are safe can be very unsteady. So ask your nurse or physiotherapist how steady they think you are and how much help they think you need to walk around. Step 2. Ask for help. People in hospital have told us that asking for help can be embarrassing and it feels like you're bothering the nurses. If you feel this way, we would like you to know it's normal to need help to do things like go to the toilet when in hospital. We are here to help you do these things as you recover. So press the call bell or just ask for help when you need it. Step 3, wait for help. Many people have fallen over even when they asked for help. That is because they started moving before help was arrived. Other patients may need our help. You may have to wait for a while for us to help you. Even if you need to do something urgently, like go to the toilet, we ask you to wait for help. Your risk of falling over and hurting yourself is much greater if you don't wait for the help you need. Now you may be wondering, when, where and why do falls happen in hospitals? Let's start with when falls happen. Falls can happen at any time of the day or night. Lots of falls happen in the morning. This is a very busy part of the day for patients and nurses. This may make it hard for your nurse to answer your buzzer straight away. Not many falls happen at lunchtime when people are sitting down eating their lunch. But there are lots of falls in the afternoon and early evening. Not many falls happen overnight because most people are asleep in bed. However, some falls do still occur. So if you want to go to the toilet, it is very important to ask for help and wait for help. Let's look at where falls happen. Falls occur in many places in a hospital: in the bathroom, in the toilet, in the shower, and by the bedside. However, 2 out of every 3 falls happen by the bedside. If you want to stop falls, think about what you do around your bedside. So why do falls happen? Falls can happen in hospital when people get up and try to do things like get their clothes, get dressed, or go to the toilet. Trying to do these things is not wrong. It's just that in hospital, people are often unsteady and can't do these things as safely as they normally do. That is why it is so important to ask for help and wait till help arrives to do these things. We know that 2 out of 3 falls are not seen by staff in hospitals. This tells us that patients are trying to do activities either without asking for help or before someone has arrived to provide help. How do falls happen? Here are the key reasons that falls happen. Falls happen because of overbalancing, like what happens when hospital patients aren't using their walking aid for support or have not waited for help from staff to support them. Falls can happen because of slips and trips. There are several obstacles that could cause patients to trip or slip if you try to walk past. Falls happen because patients' legs give way. This can happen if your leg muscles are weak. For example, when you've been in bed for a few days after surgery or have been sick. Finally, falls happen in hospital because of dizziness. In hospital, you may feel light-headed or dizzy, and if you get up out of your chair or bed too quickly, without allowing time for your blood pressure to adjust, you can fall. After all that information, take some time to consider the important question: Could I fall over while in hospital? Very few people think they will fall over in hospital, but many people do fall while in hospital, including people who didn't think that it would happen to them. So I expect your next question is, how can I stop falls and have a safe recovery? The easiest way for you to have a safe recovery is to always follow the 3 simple steps to stopping falls. Know if you need help to get up and walk around. Ask for help. Wait for help. Take some time now to plan ahead by thinking about these questions. Remember, most falls occur by the bedside, either in morning or afternoon, and 2 out of 3 falls happen when a nurse is not with a patient. Now think about what you can do to stop this fall happening to you. Here are some examples that might help you. To stop overbalancing after her knee operation, Jan will use her walking aid for support and ask and wait for help from the nurse before she walks on her own. Normally, David's leg muscles stop his knees from buckling, but he has been sick in bed and his leg muscles are weak. To stop a fall, David uses his aids, asks for help from a nurse, and does his exercise program from the physiotherapist to strengthen his legs. Jan feels light-headed and a bit dizzy when she moves quickly to get out of bed. She slows her movement and sits on the side of her bed and tightens and relaxes her leg muscles before she stands up. She also rings her call bell to tell the nurse or doctor about this dizziness. After you have started working on your plans for a safe recovery, talk to a staff member to help you review your progress and make any adjustments. This means it is time to write down some new plans. For example, to walk more with your walking aid. Always remember the 3 simple steps to stopping falls. Know if you need help to get up and walk around. Ask for help. Wait for help. Thank you for watching this video presentation, and we hope it will help you to have a safe recovery during your stay in hospital.